Well, COVID-19 is once again hammering the healthcare system in parts of Canada and the western provinces. Well, they are facing the worst impact of the fourth wave so far. And with that, let's bring in Laura McQuillan as she's been looking at the numbers for us. So, Laura, walk us through what you're seeing.
Yeah, that strain on hospitals once again, Michael. We're looking at Alberta. They've got the highest numbers of cases of COVID since mid-May, and it is flowing through to hospital systems. They are now having to move patients out of some hospitals to different places. We saw a tweet from Alberta Health Services in the past day where they said that up to 9 patients would be transferred yesterday from Grand Prairie to other places to make room in acute care and an ICU. Grand Prairie being a real hotspot within Alberta. It's got one of the lowest immunisation rates in that province, which is already lagging behind the rest of the country, and in Grand Prairie as well, delaying dozens of surgeries and other procedures over the coming weeks. They're also saying that in the Edmonton zone, which has also been hard hit throughout this pandemic, up to a third of non-urgent surgeries and procedures will also have to be postponed to make sure that there are enough beds and staff to care for all those COVID patients. But at the same time, no signs of new restrictions coming for Alberta at this point in time. Another troubling situation when you look to Saskatchewan. On Saturday, they reported the highest number of cases they have seen since January, months ago. And now the fourth wave really rising there, but at the same time lagging behind in vaccinations. They've lifted essentially all public health measures, and they're ruling out doing something like a vaccine passport. Now, when we speak with infectious disease specialists, they're really worried about that lack of public health restrictions in place, and they say if action isn't taken, things are going to get a whole lot worse.
It is kind of a scary time because, if you end up in hospital, if you get in a car accident or, you get hit by lightning or something horrible happens that you can't anticipate, that could become a situation where, again, there is literally no critical care capacity for you. And that obviously was what we were desperately trying to avoid, and which is why it's not too late to put these proactive measures in place, masking mandates, some type of certificate mandate program to try and push those vaccine rates up and to try and protect our hospital and ICU capacities before it's too late.
Now, he's speaking in Saskatchewan, but it's really interesting because as he talks about some new public health measures, that's exactly what we're seeing in other places right now.
Yeah, that's right. British Columbia, for instance, has sort of been bringing them in over a few weeks. They've got a new mask mandate, and this is, they see, their highest number of new COVID cases since April, but they are taking action. The mask mandate. They're also bringing in one of the country's strictest vaccine passport systems, though that's a few weeks away at this point. And you also look to the Northwest Territories because they have been really the national hotspot in terms of their active cases per head of population. They're also taking extraordinary measures because their hospital system, their healthcare system, feeling the strain right now. They're bringing back a mask mandate. They are delaying the start of the school year for some schools as well, just to make sure those students stay safe. And really, when you look at all these cases, Michael, and look at what is being done about them, you get this sense of deja vu, and that's what experts are saying as well, that provinces not so hard hit yet should be looking at those places that are feeling the effects of the fourth wave, that are seeing their healthcare systems under strain, and should be taking action now to prevent what they have seen multiple times in the past, but time will tell whether that will happen.
Laura, thank you for that. Appreciate it. Laura McQuillan.